Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello all, I'm Dr. Rupa Thakur. I'm a practicing ENT surgeon from Ghatpopar for the past 25 years. Today I'll be talking to you about vertigo. So vertigo is a sensation of spinning which the patient comes to us and is associated with nausea and vomiting. So when the patient, basically we have to understand that vertigo happens because there is the inner ear is responsible for the balance along with the proprioceptive and the visual receptors, which is processed by the cerebral, the brain, the central processing, that is the cerebrum and the cerebellum. So when there's any impairment in that pathway, the patient presents with vertigo spinning, which is associated with nausea and vomiting. The patient often complains of the rotatory movement or imbalance while walking. So when the patient comes to us, we have to evaluate the patient completely. We have to check the ears for if there's any atic cholesteatoma or underlying cholesteatoma, or then we also check the patient, evaluate the patient for ataxia, nystagmus, and do a complete examination of the central nervous system, the cranial nerves, and check the blood pressure also. And accordingly, we evaluate, and some investigations are also advised. Like sometimes we have to even do a HRCT of the temporal bone and some routine blood investigations. Sometimes X-ray neck is also to rule out any cervical spondylosis. And if in an elderly patient we think of vestibular basilar insufficiency, so we have to refer to a neurologist also. So normally the line of treatment of vertigo is vestibular labyrinthine suppressants along with sedatives, vasodilators, and vestibular rehabilitation exercises play a very important role in the early recovery and to prevent relapse of vertigo. And there are some lifestyle modifications which we also advise the patient, like sleeping properly, the diet, and stress also has to be taken into control to prevent the relapse and help in early recovery. But vestibular rehabilitation exercises also have a very important role in the vertigo. So hope this is informative.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.